Hey everybody, so grateful to be here with our good friend Kate Boone. And Kate has recently opened a North Attleboro location as a psychiatric nurse practitioner, right? And
Correct.
Kate, we've been chatting about how, you know, mental health is such a hot topic. It always has been, but we're grateful that the stigma is lessening, right? So talk to us about your practice, who you focus on, what options you can offer to the community for someone looking for a therapist at this point.
Yeah, so I think that was a great introduction of talking about how we're really trying to break the stigma, and I think we've done well in our generation. I think there's way more work to be done in normalizing it, like treating the whole body, right? We go to the doctor, we get our blood pressure taken and all that stuff, but we sometimes just are too afraid or too scared, or it's missed. And I think it's a big miss and an opportunity. So I am really, really excited to be starting this private practice locally. I am a Rentham resident, so I will be offering medication management sessions and add-on therapy sessions to all individuals 18 plus. I do treat the whole mental health spectrum, from anxiety, depression, ADHD, OCD, mood disorders. I will be focusing this year on getting certified in helping the women transitioning in difficult times, such as peri and postpartum, and pre-menopause and menopause. So that's something that I'm going to have a niche in my business, but I do treat the whole spectrum.
Such an opportunity, and how many people do we talk to that are going through a change and can't find, never mind a therapist, but someone who can also help with medication management. How about insurance? Help us understand how you work with insurance. What does someone need to know in the practicality of calling you and being able to utilize?
Yes, so I accept most commercial insurances, and most insurances are pretty great with both in-person and telehealth. Since COVID, they've really loosened up with that. So that's wonderful because we can reach more people. I understand a lot of people want to be in person, and I think there's something to be said about connection, but people are busy and people don't have time to race to North Attleboro or whatever. But so most commercial insurances, they also have an option to pay privately, which is an option, but yeah.
Okay, so there's an avenue to afford it. Now, how about you do both in-person and telehealth?
Correct.
Is that accurate?
Yes.
And is it just the comfort of the person you're treating?
It is. It absolutely is. I really, in a ideal world, would like to do all my intakes in person to get that connection. But again, I understand how busy people are, and I want to meet them where they're at. So I offer both telehealth and in-person based on your preference. I will be in the office every second and fourth Friday of the month.
Okay.
And I also would like to point out that I have really flexible hours, in that, I can offer evening hours to clients that can't meet me during the day.
Sure. For me, it's easy to sing your praises, right? I've known you personally, I've worked with you professionally, and I just think everybody should call you, because I know how not just qualified you are, but how genuine of an approach you bring to it. And I mean that with the utmost sincerity. But for someone who doesn't know you, why should they call you?
Yeah. I think that my superpowers are my passion for this field and my empathy. And I think, everybody who is a nurse really goes into this field because they want to help people, but I really do care, and I put a lot of effort into individualized treatment plans. There's not a 1, 2, 3 approach to this that's one size fits all. It's very individualized, and I listen, I care, I want to get you to where you want to be going. I do specialize in prescribing medication, but I will say that medication is a piece of the puzzle. And I am also that prescriber that wants to know about your diet, about your exercise, about your sleep, about your environmental stressors that are all contributing to the picture. Holistic approach, for sure. I am not the prescriber for you if you want to have a 5-minute check-in.
Yeah.
And what's the side effects? Okay, up, down, see you in 3 months.
Yeah.
That's not who I am. I want to know. I want to be involved. I say to my clients that I am your educated co-pilot.
Okay.
And you're in the driver's seat. And we go on this journey together. Unfortunately, in this field, there's no blood test or scan that I can go send to you and say, you know what, this is going to work perfectly.
Yeah. No, I think that's great. And like I said, it's easy for me to sing your praises having watched you pivot, right?
Yep.
Having watched you buy your home and rent them.
Yep.
Be part of it,
Yes,
right?
absolutely.
Have 3 children, be a working mom, balancing school, watching women go through these changes.
Yeah.
And also having that professional nursing background, and to me the icing on the cake is your genuine passion. So I think if you're taking first of all the need, of course there's a need, but the professional and personal accolades that Kate does bring to a personalized approach, not just with medication, but a holistic mental health approach. We are thrilled to support you. We would be encourage anybody they can to call you. Kate's information will be on your screen, and we'll either meet you via telehealth or nearby office. So if you have any questions, please reach out to her directly and get a personalized approach of how she can help you regroup for this year.
And thank
you
you
so
for
much.
having me
You're
in this
welcome.
beautiful space. Thank you.